Okay, well, good evening. I see it's now 7:30, which is time for tonight's Board of Health meeting. I see we have a quorum of members present, so we'll open the meeting. And actually, I believe, unless I missed my count, we have a full complement of members tonight. Is that correct? Am I missing someone? I'm missing someone. Who am I missing?
No, we
No,
have
I'm
all
not
five.
missing. No, I'm not missing anyone. Okay, I just can't count, but we'll overlook that for the moment. Um, so good evening. First thing to do is to read a script that the town would like us to read. This meeting is being conducted remotely. It's an open meeting of the Board of Health. It's being conducted remotely consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth and the local state of emergency declared by the Acton Board of Selectmen and the Board of Health due to the outbreak of the COVID-19 virus. All public gatherings have been suspended in accordance with this emergency order, and the public bodies are allowed to meet remotely and participate remotely as long as the public is afforded access and can follow along with the deliberations of the board and the votes. Tonight, we do intend to offer opportunities for public access, typically after the members have had an opportunity to share their opinions. And just final note, please be aware that this meeting is being conducted via Zoom and telephone, and it is being recorded. All right, well, with that introduction, typically we turn it over to our health director, Ms. Ball, to bring us up to speed on events with the health in the town.
Hi, good evening, everybody. So I have a few things for you tonight. So the first one being, I think you all received an email from WR Grace. It's notifying you of a public information session that's going to be held on Wednesday night, February 3rd from 7 to 9 p.m. Why I'm bringing this up is I'd like to poll you to see if there is interest in attending, and if so, I need to make sure that I either post the meeting, or if there's going to be three of you, or if there's less than three, it's not an issue. But that's the first thing. Do you want to answer that before I go on, or?
Sure. I'll just tell you, I actually know I have a conflict that night. Is it a virtual or in-person meeting?
It's virtual.
Okay, well, Dr. Taylor?
I could go, but I'm not committed.
Okay, very good. Mr. Cruz?
Yeah, I think I can attend. I'm helping out with the on-site vaccination drive that week, but I should be back in time.
Well, let me just offer. I don't think this is one where it's required that the board attend. It's if you feel you would benefit.
Oh, so am I interested? I don't know yet. I just pulled up the email and started reading it.
Fair enough. Mr. Conaby?
I anticipate trying to attend virtually.
Very good. Ms. Becerra?
I'm in the same boat, so unless something else comes up, I'd like to hear what they have to say.
Fair enough. Then, Cheryl, it sounds like it would make sense for you to post the meeting. Mark, you probably will need to stand in for me if, in fact, there is a quorum of members present. And if there is not a quorum of members present, then it's not a problem.
Okay. I'll post that.
Yeah, I think it would just say that the posting would be only for that meeting, no other business. And since it would be handled by someone else, I'm not sure how we do that, because I noticed they're talking about a Microsoft Teams type virtual meeting rather than Zoom. So I'm not sure it's going to be videotaped, or if we have to get minutes, or how, if any other boards are going to be going, hopefully the selectmen, so that would change things. So maybe you can find out, but certainly posting it can't hurt. It would also provide more information to the public about what's going on.
Okay, will do. Thank you. So the next thing I have is we completed on Saturday our first round of vaccinations for our first responders at the Boxbar Regency. Went really well, no lines, people showed up on their appointment times, pretty much, got their vaccine. They waited either the 15 minutes or the 30 minutes to ensure that there was no reactions, and off they went. So it went really well. I'm hearing all positive feedback on that. So I just wanted to give you an update on that. We did a lot, as I mentioned to you previously. Most of our police force received the vaccination, and I'm still working with the fire to get their numbers. So I'm not sure how many firefighters attended. So, I'm hoping it's significant, but I unfortunately don't have that. I do know that a lot of them went to other locations prior to our clinic. So just wanted to let you know about that. The state today announced, so currently, as you probably know, we're in phase 1, and there's 2 additional bullets left to vaccinate on phase 1, which is the home-based healthcare workers and any healthcare workers doing non-COVID facing care. So those have been opened up, and those people are all eligible to receive a vaccine. The state also announced today that they will be opening up phase 2, the first bullet, which is going to be for the 75 plus only. And that will, I think I just said, will be opened up on February 1st. So they've also amended their timeline a little bit. So phase 2, bullet 1 used to say individuals 75 plus people with 2 comorbidities. So what they've done now is they've raised the age 65, which was further down in the phase 2 list, and they've brought that up to the second bullet under phase 2 and put the people with 2 comorbidities at that level. So this got announced today. I've typed up some information that we're going to put on our website tonight or tomorrow, and so people are aware of that. The other thing the state announced today is locations to get the vaccine. So right now, if you're eligible, there are mass vaccination sites, and the 2 that I know of that are open are Fenway and Gillette. So we've got a Foxborough and a Boston, which is kind of far for our residents. So I know that there, as I mentioned previously, Leominster Hospital, Marlborough Hospital, looks like you can make an appointment at those as long as you're eligible. So once you're eligible, then you're allowed to make the appointment. So additionally, there's going to be retail locations that are offering the vaccine, like a Big Y, Wegmans, Price Chopper, Hannaford, Stop and Shop, and CVS. So it looks like, and Walgreens, if I didn't mention that one. So it looks like, those sites, I tried to do a little research on that prior to the meeting. So those sites aren't quite up yet. So when you click on the link, when you go on the website and you click on the link, it says, there's no appointments at this time, or we're working on it. So, when this is all said and done, the state's anticipating about 165 vaccination sites. So we, as a community, as Acton, have reached out to the state to potentially, bring the vaccine to our residents. So it's still being worked on. It's something that we are ready and able to do, but we just need the state to release the vaccine. So, as I mentioned, there's 165 sites right now where, we've only been directed so far as a local board of health to receive vaccines for the first responders. So we're hoping that either we're going to stay regionalized within the Neshoba boards of health and continue to get the vaccine and offer it to each subgroup. But, it's a little unknown. I tried to get that information for you all for tonight. But, we're prepared and ready if we can obtain vaccine. And then we'll start administering the vaccine to the subgroups. I've chatted with our school nurses, our fire department, who are all able to offer the vaccine, as well as Heather. Heather's on the call, Heather's staff. So we have the people, we have a pretty active MRC. So I think we've talked about this at previous meetings. We've always had a group of about 100 or 120 people who would volunteer and have gone through the process to be on our MRC. Now, since the pandemic started, I would say probably around March or April, we did a whole nother group of people. So we reached out and said, hey, if you want to do it. So now we've got new people as well. So I don't know what the total is, but we can also pull from those people to help us. I visited the Boxborough site on Saturday, walked through the process with them to ensure that, we're good to go. I had a chat with their MRC coordinator. I walked around with the health director from the Shober Boards of Health. And I actually, some people allowed me to follow them through the process. So, and I also utilize, so the state has a software program called PrepMod, which is where they want us to schedule appointments. And so I was able to actually register some people. Now, for the most part, we're going to be sending out, if we're fortunate to get the vaccines, we'll be sending out links to people to register for our clinics. And once we do that, most of the work's done for us. But there are certain people that don't have access to computers, so we're going to have to assist there. So that's assuming we get the vaccine and we can move forward. Right now, like I said, I think our closest place is really Marlborough or Leominster. And then I'm going to let Heather do her update if that's okay, but I did want to chat with you about a townwide mailing that we want to send out. If you want to let Heather do her updates, and then.
Well, actually, if it'd be okay, Charles, I have a few questions from what you just said, and other members might as well. So what I would propose is maybe we discuss your input, and then we can certainly get Heather's input, and then maybe we can talk about the letter. I'll say, I think we have one posted agenda item, and maybe we'll dispense with that, and then we can talk about the letter. Does that seem reasonable?
Sure.
Okay. So I just had a question from what you said. And it's a question I got, which is, if you've already had COVID, do you still, like say you're 75 plus, but you've had COVID, do you still get the vaccine at the same time?
I'll let Heather answer that one if you can, Heather. I think you can still get the vaccine, and I think they want you to get the vaccine, but I'll let Heather answer that.
Hi, Bill. So as long as you are recovered from a current COVID oh my gosh, excuse me, sorry, it's been a long day. As long as you're recovered from an episode, you are encouraged to still get the vaccine, even if you've had it in the past.
Okay, I was, because there was a question, well, the genesis of the question was, you're already immune from having a clinical case of COVID, so why do you need the vaccine? But you're saying the recommendation is to get it anyway.
It is.
Okay. Very good. Well, maybe this is a good time. Do other members have questions or comments on the input about vaccines and distribution? You're off. Oh, Mr. Cruz.
Yeah, so I had one question. I did read some articles today on distribution, and I assumed that it was the state was doing the planning for getting people vaccinated, but something just popped into my head while you were talking is, is the state planning on relying on local boards of health to take an active role in getting people vaccinated?
When you look at the guidance, they list it. They say local boards of health, retail stores, hospitals, and then the mass vaccination sites. So they have us all listed, yes.
Okay, but we aren't primarily responsible, it sounds like. Do you think there will be an opportunity to have a town COVID vaccination drive like the flu?
I hope so.
Oh, good. Okay, thanks.
I'm just curious, do we have the physical resources? I know I asked this once before, and from what you said, Cheryl, I'm assuming the answer is yes, but we have the cold storage facilities to be able to maintain the vaccine?
So we do have a vaccine refrigerator, yes, and I think Heather may be looking to purchase an additional, but I'm not sure we need it for the purpose of administering the vaccine. They're only releasing vaccine to us for a week at a time. And we were thinking if we're going to run a clinic that it would possibly be 2 days a week, maybe once in the middle and once on the weekend. So the most we can store is a week's worth.
Okay. And just a related, something I read in line with what Mr. Cruz was saying, is that one of the questions was, can local communities restrict it to residents only? And apparently the answer is no. So anyone that meets the criteria, regardless of where they live, even if it's in another state, should be given the vaccine if they show up. And I understand the reason for anyone that's interested is that the vaccines are technically federal property. So if you're a resident of the US, you're entitled to the vaccine.
Yeah, I mean, the only thing, the way I see that around that is, you know, as we begin to, if the state hands us a vaccine and if we can conduct our own clinic, we'll be the ones responsible for sending out the links for those that are eligible. So that'll help a little bit with that, but I'm sure those links might be shared, and yeah, but that's okay. You know, as long as we have people signed up, we know exactly how many doses we need to run the clinic. So it should be.
Well, I think that amplifies your point, Cheryl, was that, you know, we do need some sort of sign up process, because otherwise we could get, you know, potentially mobbed by folks from other areas and run out of vaccine for our own residents.
Yeah. So one of the biggest things the state is pushing right now is waste, right? No one wants to waste the vaccine. It's all on everybody's mind. So, you know, having that sign up sheet, which we'll talk about next, would be, you know, it would be beneficial because let's say, you know, 200 or 400 people register for a vaccine clinic that we're going to offer, and only 350 show up. But we have doses available. The state has directed us to be able to move on to the next subgroup. So if we have a list of who is in each subgroup, it'll be an easy, you know, pull the spreadsheet, see the people on the list, start making calls and saying, listen, we have 50 doses. If you can get here, you know, it's yours. So it's just a way to avoid waste. I mean, I would hope that that doesn't happen, that we just get the vaccine, we sign up the people up, they all show up, and we're good. But there is provisions in case.
Okay, thank you. Other members, questions or comments for the director?
Yeah, I would say another location for you to look at is Lowell General. I got inoculated there last week, and it's just very simple. There was no waiting.
Okay.
I guess I'd also mention the VA for veterans.
Okay, thank you.
Yeah, the VA in Bedford, I think, right?
Correct. I don't know about Jamaica Plain, but Bedford, I've heard friends that have gone there.
Yeah, that's where I've heard is Bedford.
All right. Well, if there are no other comments, then I guess this would be the appropriate time to move to our nursing service director, Heather York.
Good evening, everyone. It's nice to see you. So total numbers overall for COVID cases since March are 663 as of today. 39 are currently in isolation. 594 have recovered, and then 30 fatalities since the beginning of the pandemic. We still are seeing a big trend of family units being the biggest number of cases coming since the holidays came through. I have, out of the 39 that are on isolation, I probably have 3 to 5 family members within the same household who are contacts for most of these cases. So we are still seeing that household transmission in Acton still really is the highest that we're following since the beginning of all of this. So, you know, this means working very closely with the school nurses as always and the administration over at Acton Boxborough. You know, as I can't say enough about how much the nurses make my job easier with working with families, because they are really identifying people well before they come through the state reporting system, as families are in touch with the school nurses sometimes on a daily basis. So it's always good to work with them. As Cheryl said, the vaccination clinic at the Boxborough Regency went really well last week. As Cheryl mentioned, the prep mod system that the state is using for pre-registering for the clinics, that was part of the clinic at the Boxborough Regency that Neshoba Associated Boards of Health used. By them having a total number of first responders who were coming based on what they received as an allotment, it did open up the clinic for the next subgroup of home health and non-facing healthcare. They did do a small number, and that did include our agency. So our staff who do COVID facing care were all vaccinated last Wednesday, which we really appreciated them opening that up to us, since they did have the extra doses, as some of the first responders did go to other locations as the state opened up those mass vaccination sites. So that was definitely helpful for us. So we're glad that they did. Update on Life Care Center. Currently, I just found out they had one employee who did test positive over the weekend. So that person is now on isolation and obviously not working. There were not any residents that were identified as direct contacts. So that was good news. Benchmark at Robbinsbrook. We've been dealing with some positive cases over there since the 4th of January, I believe, in the memory impaired unit. There were 2 more additional cases reported to me at the end of last week. So that makes a total of 9 cases within that memory impaired unit. I believe the number of staff were 3 who have all since recovered from their active cases. They did do testing at the end of last week of the other 56 residents in total on the traditional side, and all of those were negative, thankfully. So they have gone down to weekly for their traditional residents, but they're still doing testing of the memory impaired group as things are needed, obviously, but also I believe a couple of times a week they're doing random testing for the other residents within the building. Other than that, just, you know, working with Cheryl and her team and trying to get, you know, information from the state on when and if we can do a clinic, as Cheryl talked about. Cheryl and I believe Anita Arnhem, the deputy fire chief, and she's also the emergency management director. And then one of my staff members, Kathy Flannery, will be doing the prep mod training tomorrow to help get that piece up and running. I know there was a question about storage. We do have a vaccine freezer. As Cheryl said, it does have limited space. It's not obviously the deep freeze for the Pfizer vaccine. It is, we would use it for the Moderna vaccine if and when we get that. And I believe that is all for me. Thank you very much.
Okay, thank you, Heather. Questions from members of the board? Dr. Taylor, it looks like you're off mute. I don't know if you have a question.
No, I don't.
Okay. Any other members? Questions, comments? Mr. Conaby.
Yes. Thanks, Heather. I really appreciate all your hard work and efforts. I know it's been a challenging time. Now, you said when and if on the vaccine clinic. Do you need anything from the board to move that forward, and how can we assist?
Hi, thanks. I don't believe so. As Cheryl mentioned, we're really waiting for the state to give out to open up to the new stage 2. Hopefully it will start next Monday as they talked about today. But really just waiting to find out if we are going to be given allotment as a town. But as Cheryl also stated, we do have a number of, my staff, the school nurses, Cheryl's staff, the MRC, some of the first responders who can all work that clinic and then give out vaccines. So we're just really, it's a waiting game, finding out, when we will get it, like Cheryl talked about.
Okay. Do you have any guess when you might hear?
I wish I could say
yeah.
I had a crystal ball. We're getting a lot of questions, obviously, as Cheryl is, about when we will be doing vaccines. We do, or we have been, giving people the information as we receive it from the state. And as Cheryl said, the letter that's being worked on with information on vaccinations, but also we refer people to the mass.gov website, as that really has the most up-to-date information about locations, where the state is in the vaccination stages, as we're still in stage 1. So it really has the most up-to-date information. I know Cheryl's getting a lot of questions too, and I think her staff is doing the same thing we are, just reiterating what the state keeps saying, that once we hear anything, we will get it out to the rest of the community.
Thank you. One thought, I know Council on Aging had contacted a number of seniors just doing some wellness clinics and check-ins, I should say, and maybe with the nursing service, probably having some of that information about, the changes with the 75 plus being available sooner, and the letter going out. We could kind of provide some of that information since they're some of the most vulnerable population. And then following up, I know that there were in phase 1 with a lot of the congregate care. Do you know if a lot of the congregate care facilities in town have started receiving their vaccinations by the providers, or how that's going?
So Benchmark at Brook, I believe their vaccinations were starting, I don't have the date in front of me. It was either at the end of last week or the beginning of this week. I know they were beginning their building. They were rescheduled the last time we had our meeting, about a week and a half out. So we're in that time frame that they're being vaccinated. Life Care Center of Acton has already gone through as a long-term care facility. Right. Their folks should be receiving, or the last of their folks should be receiving their second doses at the very beginning of February. So they should be good as of next week with all their vaccines, including their staff. I honestly don't know about the other group homes or anything like that. I'm not sure if Cheryl does either. I know that the state was managing that with some independent vendors.
Yeah, I know some are doing it with independent vendors, some with local boards of health. But it might be just worth reaching out to that vulnerable population and just making sure that they're proceeding. So we're taking care of all those folks. And then I guess the other question is about a lot of the senior living. I don't know if I can provide, there's been questions about providing information to them about what the availability of the vaccine would be. They're obviously not congregate living, but they're high risk areas. So that might be something else to also inquire about and see if we can help the residents with that information.
Sure. So actually, Cheryl and I had a meeting today regarding the senior living. We have a meeting tomorrow and Wednesday with two separate groups within the town about this to get that information out. They will fall obviously under the first stage of phase 1 for anyone 75 and above, and then 65 and above with 2 comorbidities. So Kelly Cronin has been in touch with Cheryl and I regarding what the plan will be, and we're working on that, and we hope to get an answer to her by the end of the week, whether it's, you know, we get the vaccine and we do that piece as a clinic at the senior housing with some, you know, backup from EMS, or if we have to, you know, hire independent vendors such as Brewster Ambulance Service is one of the ones that comes to mind. They are doing some of the senior housing in some other towns where they'll go to senior housing and do the clinic. So it'll really depend on where and when our allotment comes.
Thank you very much. It sounds like you're doing a great job. We appreciate it.
Indeed. Thank you. Heather, I just had one
Thank you.
just anecdotal question, which is, I have heard just reported in the press that the slope of new patients has started to level off and in some areas decline. Are you seeing that as well, or are you still seeing about the same pace of new cases?
No, I definitely think it's going down in town as it is across the state. Thankfully, you know, we had that big surge after Thanksgiving into Christmas, and then a new push after New Year's and that holiday week. That I think there was a lot of travel, and there were a lot of new cases that potentially came out from that. But since, you know, as Cheryl said, the governor has started to roll back those restrictions that he had put in place. So that's a good sign. Definitely not seeing the, you know, the 10 plus cases almost on a daily basis that we were seeing over the holiday. So that's definitely good news.
Okay, thank you. Any other members, questions or comments?
Bill, I'll make one comment. There have been articles in the New York Times and the Boston Globe that Massachusetts is behind in giving vaccinations. I think across all the states, West Virginia is #1. And among the New England states, we're not first. So I think there's been some irregularity of getting the vaccines out to the states. And so there may be slippages in these different phases based on vaccination availability.
So one thing they announced today is how many, by adding the retails and bringing up the amount of sites to 165, they are now predicting that we can do, I think, 350 roughly, I don't have the number in front of me, 1,000 per week, vaccinations per week, which is up almost double from what we did the previous week. So I think the state is working on a plan. I do know that the state has also, we've administered, in the state of Massachusetts, we've administered 98% of the vaccines that we have received from the federal government. So we're trying. But I agree. I think we're slightly behind some others. And I also know that some other states didn't have like the phases that we're going through. And some of them are experiencing, shortages now. So I believe that, the restrictions that are in place are for the benefit of our public.
Okay, thank you, Cheryl. So it'd be the time then, I think, to ask her. Oh, I'm sorry, Ms. Becerra.
Yeah, I just had a quick question for Heather. You mentioned that you're seeing some household transmission with, multiple individuals within a family testing positive. And I'm wondering if you've seen any, through contract tracing or what have you, any spread through the schools or community activities?
Hi, Joanne. Thanks for the question. No transmission in the schools. And I haven't seen any trend of any location in town that people, you know, are saying that, you know, that's where they are, and there's a number of them. So no, I haven't seen that at all.
Great, thank you.
Thank you.
All right, so at this time, I guess I'd ask, are there any questions or comments from members of the public for either Director Ball or Director York, the nursing and health departments?
There's
No?
nobody, no.
All right, well, in that case, if there's no further comments, we'll move on to the next item on the agenda. Thank you very much, Heather, and as always. What do you have for us next, Cheryl?
I can discuss the letter that we're currently working on drafting to send out to our residents, or we can go on to the agenda item. But I don't see anybody waiting for our agenda item, so up to you which one you want to do first.
So I'd suggest then we talk about the letter, because perhaps Heather might be able to provide some insight on the discussion. So this way we'll make the best use of her time.
Okay, I'm going to try to share the letter with you. Oh, no, wrong one. Sorry. I worked on 2 letters today. One of them was just for the updates that I spoke about for our website. So I just want to make sure I get the right one. Okay, can you see my screen or no?
No.
Oh, where's Mr. Martin? You know, he's so good with this.
You actually had it for a second, but then it disappeared.
No, the first one I had wasn't the actual letter. It was the one that I wanted to put on the website for tonight. I think it's right here. All right, can you see that?
Yes, we can.
All right, perfect. So hopefully this is the one I changed. So this is a proposed letter. I sent this to you all pretty much late today, and I don't know if you had an opportunity to review it, but you know, what we're looking to do is have a sign-up sheet for our residents. So this sign-up sheet, you know, if you look, it's a general letter. It talks about the importance of getting the vaccine. There's a few blank things here because, you know, we have partnered with, you know, like I said, we partnered with the Neshoba Board of Health. So it may be them, it may be us, it may be a different community. So I left that blank for now. The sign-up sheet that we have is basically saying to people, you know, once you fill out the sign-up sheet, we will notify you when there's a vaccine available for you and when your group is eligible, and locations on where you can get the vaccine. So I thought it was important to tell them that they may not necessarily be getting it from us, but we hope they are. But if not, what our plan is once you fill out the sign-up sheet, we'll have a Excel spreadsheet of all the groups, and then we can actively reach out to those groups. So that's our plan. As I mentioned earlier, we're currently right here in this phase 1 for these 2 last groups right here. As of February 1st, we're going to this bullet item here, the individuals that are 75 plus. And then, so I mentioned that here. And then it's also important that wherever you get your first vaccine, the state's really pushing that you get your second dose with the same organization. So I put that in there, you know, talking about potential side effects of the vaccine. And then the importance of following COVID safety protocols even after you get the vaccine, because it's going to be, I think we've talked about this previously, but it is going to be a little bit of time before those restrictions will probably be lifted. So then if you go down, so here's where we get into the sign-up sheet. Now, I will you know, I copied this from the town of Northborough, so I didn't want to take full credit. They have this sign up sheet and I mimicked it. So basically it's, you know, if you're an Acton resident or employee, he works in Acton. So I kind of have a question there. Do we include our residents who work? But as we talked about earlier, it doesn't really seem like we can restrict anyways. And if you're interested in getting the vaccine, to complete this form. So on the form, we're asking for name, email, phone number.
Heather,
so
sorry.
we also have the, yep.
Sorry to interject. On your second line in that sheet that you're on, it says compete, not complete. There it is. Second line. See, please complete this form.
Oh, yeah.
Okay, perfect.
All right. Thank you. Good catch. I've looked at this 100 times. All right. So, so we also are allowing someone else to fill out this form
Cheryl?
on behalf of someone who may. Yep.
Cheryl, I think Dr. Bill had a comment.
Can you hear me?
I'm just curious,
okay.
the time of the vaccinations, because for people not living in Acton but working here, you know, they're not going to be hanging around at night if you're giving it. So are they all daytime vaccinations?
So it looks like we're going to do it during the day on Wednesday and during the day on Saturday.
Okay.
So, you know, like I said, there's many other options for people to get their vaccinations. So if we're, like I said, if we're fortunate enough to get the vaccine, then yeah, it would be during the day. I get, you know, that's something we can think about, is potentially running it into the early evening hours if we find there's a need. We haven't really thought much about that at this point, but good point. So these questions all mimic the eligibility phases in that timeline that I showed you. So, you know, we do have the questions in here from phase 1 still, which I don't know whether we need technically, but there may be some people within those groups that haven't received their vaccination. So I believe it's probably important to keep that there. We ask, you know, the questions: are you 75? Do you have 2 or more comorbidities? The list of what a comorbidity is, also you can click on that link. And then we just basically run down the list of the state's timeline. So then on the bottom, I feel it was really important. So if people get this, you know, in the next week or so, they sign up and then all of a sudden their work says, hey, we have vaccine for you, or, you know, the whole family decides to travel to Gillette and get their vaccines. I did want a provision in here where I want people to notify us that they've decided not to get the vaccine. You know, as I mentioned before, if we're in a situation where we have to reach out to another subgroup when we're currently doing a clinic, we want to make sure that we don't waste. So, you know, in talking with our IT. So by the way, we're going to send this letter out. We're trying to decide, and I guess this is a question for all of you. So most people have access to computers, and typically some of the population that doesn't is the older population. I'm not saying that everybody under a certain age has a computer ability. So I guess I'm wondering if, number one, we want this letter sent to every resident, or if you think we should target a certain group. So I chatted with IT today. It looks like they're going to create this online form that I just showed you in a Google Doc. And we're gonna, you know, post that on our website, you know, advertise it. You can go to our website to fill it out, in the hopes that most people fill up these hard copies that you see in front of us, and we'll have, you know, staff. We have some staff right now that may or may not be quite as busy as, some other departments, and they've offered some assistance. We also have the ability to use our senior workers. So our plan is to have them take the hard copies and input them into the online system. So we have that. So that's pretty much what I have. So if you've had a chance to review it, or even some of the questions I posed, I'd love to hear them.
I have a couple of comments. As far as I know, there's no vaccine that's been approved for children. So the minimum age is 18.
Correct.
Is that right?
Yeah, I think the Pfizer.
I think it's 16. Yeah.
I don't think
I think Pfizer's 18 and Moderna is 16, or vice versa.
I think it's vice versa.
But
Okay.
I think it's important to put it in this letter because there's no reason to bring the whole family. They need to know up front. Now,
Okay.
the other thing, you have some questions in there that don't make sense given the priorities. You have a question, are you 65? Yes or no? Well, as far as I can see in the 3 phases, 65, well, actually 65 with 2 comorbidities occurs in phase 2. Is that correct?
I believe that
Yeah,
is
they're the
correct.
second bullet in phase 2.
So, the comorbidity seems to be, needs to be part of that question. Because
all right, so when I type this letter, this got changed today. And when I typed this letter, I took it off the old timeline. So yeah, I will update the timeline so it's reflected.
The 65 without comorbidity is in phase 3, I believe, April.
No, 65 plus is one item, comma, individuals with 2 comorbidities. So you can be any age if you have 2 comorbidities.
Right.
Yeah.
But if you're 65 without a comorbidity, which phase are you eligible?
Phase 2, second bullet. They just moved them up.
So all age 65, regardless whether they have a comorbidity or not?
Correct.
Okay. That wasn't clear to me.
Cheryl?
Yeah.
Do you think you could put the questions based on the phases so that way it would be a little bit easier for people to know which ones to complete?
Sure.
That might, just a suggestion on that. I guess I had 2 other comments.
Yeah, I think, Mark, that's a good suggestion.
Yeah. I guess breaking it up, some of these dense paragraphs, making it a little bit more open might be a little bit of help. And I guess the other things I would like, it's like when you go up to the top, it says, let's scroll all the ways up. It's kind of a long paragraph. We're writing to consider obtaining. I guess I would like to just see something, a header on there, something about, Acton offering free COVID vaccine, something about the word free and the vaccine to get their attention. I see Bill laughing.
Yeah.
And I guess I'd also like to see something, if we can, see what other folks think about strongly recommend, our residents receive the vaccine.
I think that's
So
in
instead
there.
of writing to consider obtaining, it's like we're writing just for the opportunity, writing to offer this vaccine. So I guess we strongly recommend it, but the writing is to offer the free vaccine. I think that might be a little bit clear.
Okay.
Maybe, I'm sure IT can make it splashier and everything else, but I think you start reading long paragraphs, it gets a little bit challenging.
We could even be more forward. We're writing to schedule residents to obtain their vaccine.
We were pleased to, offer this. Yeah, that's positive.
And if they don't want it, then they don't have to take it, but put it in the, you can bias it that we're assuming you'll want it. This is how you get it.
Yep.
Okay.
Hi, Cheryl. I'm assuming this will be translated in a couple of different languages.
So what we normally do is at the top of the letter say it's, I don't know. That's a good question. Like for the online version, I think you can just click on our website. You can click and you can switch over to a different language. So I'll make sure that. And on this letter, what we normally do is on the beginning, we say something like, this is very important, please have it translated. And we put that in about 5 or 6 different languages.
Okay.
So this is going to be on the website, actonma.org?
Correct.
Okay.
.gov.
Yeah, .gov, yeah.
.gov, all right.
Are you planning on emailing this out or putting it part of the newsletter, or how would that go?
Yeah, we'll get this out, social media, and anybody who signed up for the notifications. We'll get this out in every possible way. And that's why, like I said, I suspect that most of it will be done online with a few that need to fill up the hard copy.
I think that was your original question, Cheryl, is do we want a hard copy mail the entire town?
Right.
Or only the people that we suspect may not have access to a computer? And I don't have a good answer to that. I would actually suggest a reverse 911 that says, please, check the town website. If you don't have the ability to check the town website, call the health department at 929, so forth. And then that way you might limit your written mailing to only the few that can't get it off the website, which I suspect is not zero, but it's probably a small portion of the community.
Okay.
What do other people think?
It seems reasonable, Bill. I think maybe, I'm sorry, go ahead, Bill.
I think the reverse 911 is effective. The last one I got came through on my voicemail, which is nice. So, because a lot of people don't answer their phone when it rings. So as long as it does that, I think it could be very effective.
I would second that, but I would also suggest that you email it out, because I know, like when I or my father gets the stuff, he says, well, I'm not sure I heard everything. So it's nice to be able to read it as well. And you can obviously post it at town hall, library, and you can, maybe at some of the senior places, they're more accustomed to receiving some of the written copies. And if somebody requests it, we can certainly mail it to them. But I think probably the electronic age is at us, and having non-contact transmission is better.
Okay. Any other suggestions? Members of the public?
Bill.
Hello, Mike.
Yeah. Hi. Yeah, Cheryl, I asked a question about, having some misunderstanding about, is the state doing this, or is the town local board of health having any responsibility? And I think part of it was I read this before the meeting, and as I read it, it looks like, hey, the board of the health department is responsible for distribution. It doesn't really list any of the other options. I think, from my perspective, it doesn't really matter where people get it. But I think I think maybe offer, besides the link that you have, I know you just scrolled to that, but some other places that we know we can, that are planning to have it, like the CVS, Tom mentioned Lowell General, but maybe include some information that we're not the only people who are offering the vaccination.
Yeah, I actually made some changes to this document, and obviously I pulled up the wrong one because I was trying to make it more clear that we may or may not be the ones offering the vaccine, but we want to be able to tell people where or when they can get it. But I can definitely add some locations in the letter, not an issue.
Yeah, or at least just say up front that Acton does not currently have vaccine available, but when we do, we will offer COVID vaccination clinics, and then have this as a sign up to do so.
But it's hard to put other destinations in if they may not have the vaccine. Like if you list CVS and Walgreens and who knows what else, Stop and Shop, all of those. How soon are you going to send this out, Cheryl? It seems to me if there's a flow of vaccine into Acton, it's going to be primarily through the mass vaccination.
Yeah, I mean, we wanted initially to get this out, by the end of this week. But I agree with you. The update I did for the website, not this letter, I did put in location, so I can add that to this letter. And I don't have any issue with adding the locations. Like there are a certain few at this point that are up and running, so I can at least put those up there. And then I can make a mention of additional ones that are coming down the pike.
Cheryl, could you just put the link to the state website that has the list for the most up-to-date information?
Yeah, I thought I had that on here.
I think it was on there, but I think Mike was alluding to that. But yeah, there you go.
Yeah,
that might be the easiest way, but maybe just be a little bit more transparent that there are other options and other sites. We just encourage people to get vaccinated, no matter where, as soon as possible.
Okay.
Yeah, I agree with Mike. In reading this letter, I think most people know when their group is eligible. And I think when you read this letter, it gives the impression that all they've got to do is sign up and wait for the Board of Health to get in touch with them. Whereas there's a lot of other ways of arranging for your vaccine and getting it a lot faster than waiting to see what's going to happen here. So I think a link to the state site that gives you all the other options is very necessary. And on another subject, you talked about people from out of town coming in because they can. Maybe we can't restrict it, but I don't think we have to go and advertise it.
Very true. And that's all as Heather and Cheryl have said, assuming we even get vaccine to begin with.
Yeah, I mean, and I think the letter's well-intentioned, but I think reading it, it sounds very optimistic that the Board of Health or the Health Department is going to have it, when I think realistically, maybe that's not the case.
Yeah, maybe be transparent about we haven't received it, and any doses will be limited or something like that.
We just wait to send the letter until we get approval from the state. That would solve that issue.
Yeah, but I guess if it's only like 500 doses a week or whatever they allot us, it's I think let's not try to oversell the capabilities, especially because there haven't been any announcements that we're getting any to begin with, and there's no guarantee that we will, right?
I believe that's true.
Yeah.
I think what Cheryl is trying to do, and Cheryl, this is where you can jump in, and is, we're trying to get ahead of the curve, right? We're assuming that, we're getting a lot of questions from residents. Hey, when can I get vaccinated? Where can I get vaccinated? Who's going to do it? That sort of thing. And so we're trying to say, well, we're making a plan. We're making a plan to be able to roll out the vaccine to the residents as expeditiously as we can, based on whatever the resources are that we get, whether it's a regional, whether it's the town, whether it's retail stores. And we'll try to, communicate that to the people as needed. If there's a better way to do it, then we should look at that.
Yeah, Bill, I think that makes sense. I think maybe that, we're excited to be have a part of the vaccination rollout or something like that, and we'll do what we can. But I think set expectations appropriately.
Cheryl, are you aware that there's a specific computer program for signing people up?
Yeah, PrepMod. We mentioned that. Yeah, we have to use that.
You have it?
We have, I think Heather mentioned, myself, Heather, and our deputy fire chief, and one of Heather's other staff are all taking the training tomorrow.
Okay.
So yes, we will have it.
Good.
Well, so Cheryl, I'm not sure. We offered some suggestions, the board did, and I don't think this requires a board vote. But do you feel you have a sense of what the board is looking for, or do you still have questions, or?
No, I have a sense, and I understand what you're saying, and you're absolutely right, Bill. I mean, my purpose is to be, hey, listen, there's a vaccine. If you sign up, we'll get you an email that tells you when you're eligible and where you can go. So that's pretty much the purpose of this, and hopefully the state distributes vaccine to us, and we can offer those clinics as well. So when we're sending our notification to our residents, we can also be included. We can say, all right, we're having a clinic on such and such a day. Your group's eligible as of this day. Please use this link to sign up. So that's pretty much what we're trying to do, is just notify people that we're ready. and also if they don't distribute it to our community, at least we can get the information out to them pretty quickly. Once, like this afternoon at 12:30, the governor comes on, does a press release, basically opens up phase 2 for February 1st. So we could get that notification on any given day, pull up that eligibility list of all the people that are registered, with the click of a button, send them an email and say, here you go, you're up on this date, and here's where you can get the vaccine. So that's the whole purpose of this letter. We get these questions. Heather's getting them, I'm getting them. I feel like this would I feel like our residents need to see something like this at this point. They need to understand that we're ready and willing and able to help them get vaccinated.
Yes, I agree. I think I'm sure they know we're aware, but they'd like to know that we're actually doing something about it.
Yeah.
Even if we're constrained by outside forces, it's like, it's not us. It's as soon as we're afforded the material, we'll start vaccinating people.
Yeah, so I can make the changes that you all discussed and get that ready.
Okay. Well, since this is going out in the board's name, let me just ask, is there any board members that have concerns? And if so, please speak to your concern about this letter going out, sort of in our name. Anyone?
So yeah, Bill, I think this is actually a very good idea, and I think offer sign up for, in the case that we get an allotment of vaccine, let us know that you're interested so we can distribute as soon as possible and to as many people as possible.
Okay, thank you, Mike. Other members?
Yeah, I think it's a good idea, but I don't think it should be so optimistic that they're going to get it through the town and not have them try and get resources on their own.
So you're saying don't oversell it.
Exactly.
I can tone it down and at least add the changes that you guys mentioned. So I think that would help.
Okay, well, other members' comments? Then I'm going to just suggest that I believe the board is in favor of the letter with the changes as we've noted. And please go ahead.
Okay. Thank you.
Thank you. Thank you, Heather, even though we didn't need to call on you.
No problem.
Good night, Heather. Talk to you tomorrow. All right. So the actual agenda items that we have for this evening are two not new emergency beaver trapping permits. So I got the request I actually was chatted with the one for the USGS, within that 10-day extension period that the board automatically grants. But due to the weather conditions, they couldn't get out to utilize that 10-day extension that the board can grant, or the board automatically grants when we do these approvals. So they are looking to pretty much start a new 10-day permit. And the same goes for the property at 183 Arlington Street, which is affecting, in both cases, it's affecting the septic systems at various homes, like quite a few for the property on Arlington Street. And the other one is actually not septic systems, it's affecting the
Gauge.
US gauging system. Yeah, sorry.
Okay. So I think what I'm hearing is we have petitions for new reissue of permits that we've previously granted due to timeline constraints. And the rationale for those permits remains the same as when we previously granted them. So I would just like to ask if the board is willing to do perhaps an expedited, process on these permits, considering that they're a reissue. And I'll just say, does any board member wish to have any questions or speak to either one of these at this time?
No.
Mr. Conaby.
Yeah, it seems like we've had them quite a bit, and obviously the beavers are still very active and causing a lot of problems. I think there was a note about potentially looking at more of a holistic, longer-term approach, which seems like a good idea, particularly for the USGS gauging station. So maybe we ought to be suggesting that the applicants look at some of those things, and the town does as well, but I don't think it really impacts tonight, where it's really an imminent threat to public health and with the septic system. So I just wanted to make that comment, but yeah, I agree with your comments as far as expediting.
Very good. Dr. Taylor.
Yeah, who pays for that?
The town. If
the
it's
town
town land, the town pays for it, yeah.
But if it's not, like, the gauging system may not be town property, and do the residents, for example, have to pay for that?
I don't think, I mean, conservation does the, he does a lot of the inspections, and then he either makes a determination that it needs to be done or not. And, I don't get too involved in who pays for the cost, but I don't think there's been a case of ones that you guys have done that a resident's paid for, but I'm not 100% on that.
Okay.
I think that there has been, Cheryl. I think a couple applicants have said the costs, and I think, as they put it, there was a bounty on the cost of each beaver for trapping and for removal.
Yeah.
So I do think that there are certain private applicants that have had to pay to have this situation remedied.
Yeah, possibly. I like I said, I don't say, hey, who's paying for this when I get the request. So I don't know.
There's a licensed trappers, and I know that they do charge a fee. So I think to answer your question, Bill, is unfortunately this is not always a situation where it's a public situation where the town would be the one incurring the costs.
Yeah, that makes sense, actually. But that can also have a decision in how quickly it needs to be done, or other factors like the cost.
Indeed. Ms. Becerra, I think you were looking to make a comment.
Yeah. So I echo Mark's earlier comment on having the town look at a more holistic long-term approach, because the beavers are just going to come back once you get rid of the dam and whatnot. So I'm wondering if we can formally request, I don't know if it's the Conservation Commission or what, but to investigate installing these devices. I think they're called Beaver deceivers around these locations where we seem to have repeat customers, if you will, just to, so we're not continually trapping beavers, but also allowing for water to flow and not causing floods. So I don't know if instead of just, having the town look into it, if we could do something a little more formal, like, investigate putting them in, or, something like that.
So a suggestion, maybe we ask one of the Conscom or Tom Tidman to join one of our meetings one day just for informational purposes. We've gotten presentations on the beaver deceivers before, and there's a variety of other methods to try to, that are less than lethal, I guess I would say. And they all seem to have their purpose, but they also seem to have some drawbacks where they don't apply in some situations. And I don't know. I mean, I remember the different people that gave us those presentations. Some were like Jack Norton, I think, did it one time. But I'm just trying to think of who would be the best to do it currently. Cheryl, do you have any suggestions? I'm thinking Tom, but.
Yeah, I think Tom, and possibly the trapper that he's using now. It's a different trapper than Jack Norton now. I also remember, and I don't have the notes in front of me, but when the USGS was before us for the last one, I'm pretty sure we talked about beaver deceivers, and he mentioned why they weren't working in his case. So, possibly even asking him to join, right? Because he seems to have some experience with that. So, yeah, I can definitely reach out to whoever you'd like and have them do a talk about it.
Well, my suggestion would be, let's not do it as part of an agenda item to issue a permit. Let's do it as an informational session.
Okay.
And then that way, it doesn't have to be tied to a specific set of facts, and we can just explore what the options are.
Yeah, I think a proactive approach, Bill, and do a little planning. I think the water district has had a lot of problem areas, and they've had some experience. And we've also got delegated from wildlife from the state. They may be able to provide a little bit more information upon some of these situations and what are the options for it. So I guess what we're suggesting is something to add to the list in the future to look at, so we're not just reacting to each of these situations as it becomes a crisis, but a proactive, holistic approach. And
yep,
like you say, they've tried certain things that were not effective. So
yeah,
we need to be a little bit more cognizant of that as we're doing the permits. I didn't mean to digress too far. I just wanted to mention that.
Okay. Well,
yeah, they're probably, work in, certain, site conditions. So it would be good to know.
Yeah, we had a presentation from a wildlife fund. Gosh, Mark, this was back when we used to meet in room 126, and I don't remember if you were a member of the board at the time, Joanne, but I remember the bottom line was that all of the techniques can work for a while. The problem is, if they actually work, the beaver population in that area just continues to expand, and eventually you're kind of left with, you have no choice. I mean, your techniques for keeping the water flowing and preventing impact to the septic systems and things like that can work for years, but eventually, instead of 5 beavers, you have 25 beavers, and now they just overwhelm your defenses effectively. That's my memory is, but technology's advanced, and perhaps there's better solutions now, and it wouldn't it wouldn't hurt to get an update from people that have got experience. So I guess I would say that's not a priority, Cheryl, just a suggestion to the members, but I think it's clearly there's interest from the board.
I can work on that.
Great, thank you. So given the reissue issue before us, would any member care to make a motion to reissue the permits?
Bill, I'll make a motion to reissue both permits.
Thank you, Mr. Cruz. Is there a second?
I'll second.
Thank you, Joanne. Ms. Becerra, motion has been made and seconded to reissue the permits. Further discussion? Hearing none, all those in favor, please vote aye. That would, excuse me, all please vote. Dr. Taylor, how do you vote?
I vote aye.
Mr. Conaby?
Aye.
Mr. Cruz?
Aye.
Ms. Becerra?
Aye.
I also vote aye. Motion carries unanimously. Thank you. Does that conclude our official business for tonight, Cheryl? No.
We have the 2 minutes, 2 sets of minutes.
So can we do this in 2 minutes? No, just a joke. I'll confess, I didn't read them, although I have to say lately the quality of the minutes has been terrific. I think the fact that the meetings are recorded helps a lot, but they've been spot on. So does anyone have any comments or concerns regarding the minutes?
Well, I was able to read them. One of them was a long meeting. There's a lot of details. I didn't find any inaccuracies in either set of minutes.
Thank you, Dr. Taylor. It almost sounded like a motion, almost.
Oh, which are we doing? You're asking for a motion on both minutes? Both sets?
Probably should do them in order.
I would ask Dr. Singh if, just there's one note about being apologized to. I was wanting to get your feedback on that. Should it be in the minutes?
No, I don't think so. The apology is more than enough, and I don't want anything to go in the minutes.
Okay, I can remove that. That's in the 12-14 minutes.
Yeah.
Was the meeting called to order at that point?
Yeah, it was during my updates, I think.
You can certainly just say there was a brief discussion regarding Dr. Singh's official title or something like that, but I don't think we can edit out things out of the minutes. We're supposed to reflect the events of the meeting.
Okay, maybe strike the apologize then. I don't know. Dr. Singh, what do you have a view on that?
From my side, I would like it to be removed because Cheryl already said that, and it's okay.
Yeah, or you could, Charlie, you could just very much soft pedal it, opened with a discussion of board members' status or something like that. And
okay.
And then, I think we're covered.
I'll
Somebody's pizza's done.
Now, just remember that we have 2 minutes to do the 2 minutes. I want to see that in the minutes.
We're always seeking to improve, Dr. Bill. Well, thank you. Anyone else have any comments on the minutes? And I guess let's take them in order. So I apologize. Which set is first, Cheryl?
December 14th.
Okay. Ms. Becerra.
Aye.
I'm
sorry.
Well, thank you. That's a good start. So I'm going to take that as you have no comments. But
I have no comments, correct.
But that might actually be a motion. So do you move the minutes of December 14?
I do if there are no comments. I didn't have any.
Very good. Is there a second?
I'll second it.
Very good, Doc. Thank you, Dr. Bill. All those in favor of the minutes of December 14, Starting with you, Dr. Bill.
I'll vote aye.
Mr. Cruz.
Aye.
Mr. Conaby.
Aye.
And the person who I'm pretty sure we know their opinion, Ms. Becerra.
Aye.
Thank you. I also vote aye, so those minutes are approved unanimously. On to the next set.
January 11th.
Is anyone, Dr. Bill?
Yes, I'd like to make a motion that we accept those minutes as written.
Is there a second?
Second.
Thank you, Mr. Cruz. All those, let's please vote. I'll go backwards this time. Ms. Becerra.
Aye.
Mr. Conaby.
Aye.
Mr. Cruz.
Aye.
Dr. Taylor.
Aye.
I also vote aye. We approve the minutes unanimously.
Okay.
Thank you very much.
That's
Any
all
other? So I don't know if that quite met the threshold, Dr. Bill, but I'd say that was above par or below par, however you. Do we have other business tonight, Cheryl?
No, we don't.
Great. Then this would be the time. Are there any comments, questions, concerns of members for the department or just general information?
The only thing, sorry, I should have brought this up is the next meeting is scheduled for February 8th, I think, which is 2 weeks, right? We okay with that?
I think so. That was the hidden agenda of why I asked Heather the question about what the trend was. And, it seems like it's encouraging news. So, but what do members think? Does that sound reasonable?
We could keep it on the calendar, and if we need to cancel it, then we'll do so.
Okay. You don't see the need to schedule one between now and then? That's I'm suggesting we don't.
I don't think so. Yeah, I don't see something.
Unless we expect something on the vaccine distribution or some other change from the state, it seems like it's not necessary. Then it would be an emergency, which we could post if we have to.
Okay. All right, then February 8th is our next meeting. If there's no other comments or concerns, then
move to adjourn.
You beat Dr. Bill. We'll give him an opportunity to second then. Do you care to second?
Let me see, am I on mute? No. Yes, I vote to second it.
All right, very good. I think we can do this by voice vote. All those in favor of adjournment, please say aye.
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 And
How about
aye.
Abstainers?
Does anyone wish to abstain? I believe the ayes have it, so we stand adjourned. Thank you all again. I think, there's some good news. We have a vaccine. We hope to get it soon. The trend is starting to look favorable. So by golly, we might have made it. So again, thank you all and see you in a few weeks.
But hold on to your masks.
That's right. That's right. Stay away from each other.
Good night.
Good night.
All right. Good night.
Thank you.
Bye.
Good night.